Hello, my name is Dr. Groisman, and today I wanted to look at neurologic symptoms from a spinal leak. They can be wide ranging. Rather than list all the neurologic symptoms possible right off the bat, we're going to look at how the neurologic symptoms are produced. And then we're going to go over a hypothetical case study. Our bodies are machines, and the spine and the brain are no exception. Just as a car engine needs engine oil, your central nervous system needs spinal fluid. Have you ever ignored the low engine light on your car and kept driving? What happened? The low engine oil light comes on when the oil pressure is too low and the oil does not flow through the engine properly. Low engine pressure can happen when the oil level is low due to causes like an oil leak. Without sufficient oil in the car, this can cause the engine's moving parts to rub against each other, causing friction and make it overheat. Similarly, without sufficient spinal fluid flowing through your central nervous system to cool, cushion, and clean, you will face mechanical failures. When you have a leak in your system, your spinal fluid volume inside your head will run low and your brain will not be adequately cushioned and supported. There are many discussions in medicine on what exactly causes the head pain from spinal leaks and where exactly the head hurts as a spinal leak symptom. While hurting can occur on both sides and at the base of the skull, this is a common type of head pain. The reality is that with a spinal leak, your brain is not cushioned by enough fluid to be lifted up off your skull bones. Everyone's skull has a different shape, by a little bit anyway. For some patients, their brain may tip to one side or another, the back or the front, and cause pain by leaning against the sharp edges of your skull. The common idea is that spinal leaks always result in sagging at the very back of the brain, but this is not necessarily true. Some people can have the brain sag significantly at the front of their head. Sag at the front would be frontotemporal brain sagging, and one potential cause for frontotemporal brain sagging is a spinal leak. The frontal lobe of the brain is important as it is responsible for our personality and communication abilities. With your brain sagging forward, strain is being placed on that part of your brain, and especially causing an impact there with behavioral and cognitive decline. People with frontotemporal brain sagging from a spinal leak can be misdiagnosed with dementia or schizophrenia and even placed in nursing homes at a young age when their condition is actually reversible. Even if you are a spinal leak patient who typically presents more with symptoms of your brain being affected more in the back, it's completely normal to have some bad days where you can feel your brain tip forward and you start having more of these types of cognitive or behavioral symptoms. You may go through days when you feel sudden bursts of rage, hear voices, feel a mental block where you can't speak, only for this to all go away a few days later. While there is a minimum invasive solution for a spinal leak in the form of a blood patch or an epidural blood patch, which seals the leak site, many patients' priority is often just to know what's going on. Let's look at a hypothetical case study. Patient A, who we will call Brandon, is in his 20s with Ehlers-Danlos syndrome or EDS and an undiagnosed spinal leak. Brandon has not slept for 3 days due to back pain. He's self-medicated with smoking pot, which can lower intracranial pressure. Sleep is important in spinal leak cases, as spinal fluid circulation increases during sleep. However, it's a catch-22, as leaks can cause insomnia. Brandon has a psychotic break and is taken to the emergency room. He is kept in the ER for several days without the ability to sleep before finally being committed to a psychiatric hospital. He is eventually released without any real guidance for next steps or understanding of why this break from reality happened. Brandon stopped smoking pot and is more coherent and able to navigate his delusions. Somewhat better, but he is still struggling. His main complaint is local back pain above his waistline and shooting nerve pain down into his thighs, with the latter source of pain being the main issue that is causing his insomnia, along with many hypnic jerks, which are sudden involuntary contractions of the muscles of the body which occur when a person is beginning to fall asleep at night. A lumbar spine MRI is ordered for him that shows severe disc degeneration in the lumbar spine, and that is thought to be pinched nerves. He is offered an epidural steroid injection and pain management, which he refuses due to his sisters all having had epidural leaks. One common complaint about medicine is the lack of holistic evaluation of the body. Every part is separated into pieces, and the whole person, the whole body as a machine, is not examined in full. The orthopedic surgeon heard back pain. During the consultation, and order a lumbar MRI and simply diagnose the patient with disc degeneration. No questions were asked about sleep quality, mental health, or more to send Brandon on the right track. At this point, Brandon feels hopeless and does not know what to do. But there is hope when medical professionals look at the larger picture to better understand what's happening and then break down the larger picture into steps we can take to help patients. Next week, we will continue this hypothetical case study to explain how we can approach this case with Brandon. The goal is to create a convenient, coordinated care to help him avoid common pitfalls in testing and imaging, where patients often are given additional spinal leaks, and to create a comprehensive care plan. Make sure to like and follow this account as I create more educational content to guide people in exploring root causes and developing plans designed to improve spinal leak patient quality of life. Thank you so much, and this is Dr. Groisman signing off.